In this section of Chapter 2, we're going to be looking at some of the guidelines for active adults. Now, the guidelines for adults will focus on two types of activity: aerobic and muscle strengthening. Each type provides important health benefits. Typically, adults are not getting enough physical activity. The CDC reports that only 21% of adults are getting enough exercise. Let's look at how some businesses are addressing this lack of exercise.
If generally speaking you don't exercise enough, then you are in fact like most of us. 79% according to the Centers for Disease Control and Prevention. Changing that could help not only employees, but their employers as well. And tonight from Fox 11's Alex Ronaldo, what some area companies are trying.
For good health, the CDC says we should exercise 2.5 hours each week, but finding motivation is not always easy.
Usually I come home from school, I want to just sit on the couch, and that's the hardest part. You want to get out of your relaxed stage and get to the gym.
Finding time is also tough.
Time is always a big one. Having family, having work, working long hours.
According to the CDC, only 21% of American adults find the motivation and time.
It doesn't surprise me at all because we found the same thing here amongst our employees.
At Network Health in Appleton, Deb Anderson says the company started programs to encourage exercise. There's a gym on site, walking routes are mapped out, and everyone has pedometers.
It's very helpful to be able to do it throughout work. I know there's a bunch of people who like to go for 20 minutes, 30 minutes during their lunch.
Network also holds competitions among employees, for example, giving prizes for the most steps walked. At Faith Technologies in Menasha, it's similar.
We try and change it up each year and offer different programs. We offer it to their families so that their spouses and children can get involved and just make it as easy as possible for them.
Faith Technologies even tries to keep people motivated to take the stairs by putting signs like this one in the stairwells. Faith also gives reimbursements for gym memberships and fun runs. The companies say it's paying off, claiming healthy employees are more productive.
You can see reductions in absenteeism. Exercise reduces your stress levels. It increases your endorphins.
In Greenville, Alex Ronaldo, Fox 11 News.
This is just one example of how the workplace is trying to increase the percent of adults who work out. Because in essence, if we can get our working population healthier, they'll be more productive and they'll cost less. They'll have the cost of society will be less in terms of insurance and insurance claims. Aerobic activity or activities are also called endurance activities, and they're defined as those physical activities where people move their large muscles in a rhythmic manner for a sustained period. Running, brisk walking, dancing, and swimming are all examples of aerobic activities. As we've learned earlier, the suggested amount is 150 minutes per week of moderate intensity aerobic activity. And when adults engage in aerobic activity at this threshold, the benefits are substantial. These benefits continue to increase when a person does more than the suggested 150 minutes per week. Dr. George Carlton gives us some great advice on adding aerobic activity to your current lifestyle.
If you're looking to get healthy, particularly if you haven't been active in a while, then you need to think about your overall health level. And if you're someone who doesn't have any heart disease, and by and large you can do all your daily activities, then you should be able to go right into an exercise program safely. If you are somebody who's had a history of heart problems, and especially if you haven't seen a physician in a while, then you really ought to talk to your general internist or see a cardiologist before you start any kind of new exercise program. The general recommendations are at least 30 minutes of exercise up to 5 days a week. So a fair amount of exercise, probably more than most people would suspect. However, it doesn't have to be 30 minutes constant. It can be broken up into individual periods of at least 10 minutes or so. And so sometimes that's a way that people can work that into their daily routine, and they actually may find that it fits their routine better than they had thought. The most important thing for people with or without heart disease when they start an exercise program is to start slowly and listen to your body. If you start having any kind of symptom that you get with exercise that gets better with rest, whether that be shortness of breath, chest discomfort, arm discomfort, back discomfort, no matter what it is, that's something that you really ought to pause and speak with your physician about. But as long as you start slowly, increase slowly, and listen to your body, most people do very well. More exercise is associated with longer lifespan, lower risk of heart attack, lower risk of congestive heart failure, lower risk of stroke, and higher functional level. So it's not just how long you live, but how well you live. People who exercise regularly can even do so very late into life, and they maintain a lot of independence. From a health standpoint, I don't recommend people follow their weight as closely when you're starting an exercise program. Losing the unhealthy weight, such as fat tissue, and replacing it with muscular weight, your weight may not change at all, but your overall health is going to be significantly improved. And so what's most important, I think, is how you feel, more so than how much you weigh.
So how many days and for how long, what's our frequency, what's our duration? Well, your activities should be spread out throughout the week. Research shows that exercise, when performed for at least 3 days per week, will produce health benefits. We also have to be concerned about the intensity. And the guidelines for adults focus on 2 levels of intensity: moderate intensity activity and vigorous intensity activity. The general rule of thumb is that 2 minutes of moderate intensity activity counts the same as 1 minute of vigorous intensity activity. In your textbook, we'll outline specific examples of each type of intensity activity. Now, we also want to be concerned with muscle strengthening activity. These activities provide additional benefits not found with aerobic activity. The benefits include increased bone strength and muscular fitness. Muscular strengthening activities can also help maintain muscle mass during a program of weight loss. Now, muscle strengthening activities make muscle do more work than they're accustomed to doing. As we learned in section 2, they apply the overload principle. We do have to be concerned about some other special considerations. Flexibility is an important part of physical fitness. Stretching exercises are effective in increasing flexibility. However, it is important to remember that the time spent on increasing your flexibility does not count towards meeting the aerobic or muscle strengthening guidelines. Warm-ups and cool-downs are 2 components that are an acceptable part of an individual's physical activity plan. Commonly, the warm-up and cool-down involve doing an activity at a slower speed or lower intensity. The general purpose of the warm-up is to increase the heart rate, which in turn increases the blood flow to the muscles. The cool-down functions to gradually decrease the heart rate at the end of the activity session and basically return you to a resting state. So including a warm-up and cool-down is important, and this short video will summarize the benefits of both.
When some people exercise, they may just jump right into the activity and not give a second thought about a warm-up or a cool-down. However, there are numerous benefits to performing a warm-up before exercise and a cool-down after. A warm-up is used to increase blood flow to the muscles going to be trained and decrease muscular stiffness. It is important to target the muscles that will be utilized the most. For instance, it wouldn't make sense to warm up with lunges and have blood rush to your legs when you are warming up for a bench press. The idea is to have increased blood flow to the working muscles, which will result in increased oxygen and nutrient delivery to those muscles and decrease the risk of injury. During a proper warm-up, the muscles are actually warmed up, as in the temperature in those muscles increases. This is beneficial because warm muscles will be able to contract with more force and relax quickly. This results in enhanced speed and strength. A warm-up also improves the muscle's elasticity, which decreases the risk of pulling said muscle. Risk of injury is decreased because a warm-up prepares a muscle for strenuous activity and helps prevent overstretching. A proper warm-up will cause the blood vessels to dilate and reduce the resistance of blood flow, lowering stress and strain on the heart to pump blood. A warm-up will also prevent overheating by promoting the dissipation of body heat through sweating, and it also increases the range of motion for joints, which will help decrease the risk of injury. A good warm-up exercise would be to jog for a few minutes, coupled with sprints or brief high-intensity running. A warm-up will be different for everyone, so find out what works best for you. Recommended time is about 5 to 10 minutes, while upwards of 15 minutes is recommended for the elderly and those recovering from injuries. A cool down is just the opposite of a warm-up, but it's just as important. The primary goal of a cool down is to return the body to baseline values before exercise. This consists of reducing the breathing to normal levels, lower the body and muscle temperature to pre-exercise levels, and allow the heart rate to gradually reduce to a normal rate. By not cooling down after a workout, the body is not given adequate time to recover and re-stretch the used muscles. Stretching after exercise will both lengthen and strengthen the muscles, which will help with recovery and better prepare the muscles for the next exercise bout. Cooling down helps to dissipate lactic acid away from the muscles where it has been concentrated due to exercise. This is important because lactic acid will change the pH levels in the cells, making them more acidic and decreasing the effectiveness of enzymes involved in cellular metabolism. Dissipating lactic acid will allow a faster and better recovery after exercise. Blood pooling can occur after stopping exercise suddenly and not cooling down. During exercise, the contracting muscles help to force the blood through the vessels and back to the heart and resist the force of gravity. By suddenly stopping exercise, the muscles are no longer contracting and assisting with the flow of blood. This allows the still fast-flowing blood to pool in the legs due to gravity, which can cause dizziness and fainting. A cool down should last for at least 5 minutes and should include stretching. Static stretching, holding the stretch, is recommended and should be performed on the muscles used during the exercise and be held for between 12 to 30 seconds. Note that static stretching is only recommended for a cool down and not a warm-up because static stretching can limit muscle force and speed. If you don't usually warm up and cool down when you exercise, try it the next time you go to the gym and see if you can notice a difference.
So please be sure to remember these considerations when you exercise. So how do we get started and how do we stay active? Well, adults can meet the physical activity guidelines in a variety of ways. Your choices depend upon your physical health and your fitness goals. Be sure to read through the real-life examples that are included at the end of the section in the textbook for more information.